Hi, I'm Oliver from London Clinic of Nutrition. Today I'd like to talk about long COVID. And what we're seeing is that many people are getting symptoms of long COVID, or you could call it post-viral fatigue, with other conditions like chronic fatigue syndrome. And what we're finding is that either patients are getting long COVID from either the historic exposure to COVID, but also from vaccine damage as well. And I suppose the good thing is that the treatment for patients, whether they've had their symptoms since COVID or whether they've had their symptoms since the vaccine, is that the treatment is relatively similar and goes along the premise of how we treat many of the patients we have for many years at the clinic with post-viral fatigue and chronic fatigue. The most common two symptoms that seem to be mentioned of long COVID are fatigue, obviously, but also respiratory issues. And one of the things I found personally with patients that works really well for the respiratory issues is nebulizing glutathione and iodine. And again, clinicians within the team can advise patients how to do that. It's very cheap and straightforward how to do. What we're also seeing is that ivermectin is a very useful drug for treating post-viral fatigue and long COVID. And also another big thing to be aware of is that, and what we're finding as well, is that with patients with long COVID, that the mitochondria, which are the energy powerhouses of the cells, have been damaged or poisoned. And we're now in partnership with a laboratory in Germany which offers very interesting mitochondrial testing, probably the best mitochondrial testing that I've seen. And it's based on the seahorse technology, where there's around about 7,000 research papers published. So it's got a good body of evidence behind it. And one of the nice things with this test as well is that we can look at things like lactate to pyruvate ratios of patients and see whether a ketogenic diet is hampering them or benefiting them or not, and whether they're using fatty acids as fuels or carbohydrates, let's say. And I find that being a herbalist, I find that herbal medicine is very, very useful for treating long COVID. Specific types of herbs and also specific types of nutrients can be very, very useful for repairing the mitochondria in patients. So do get in touch with the clinic today, as we have a huge wealth of experience in treating chronic fatigue and post-viral fatigue in patients, which again, as I say, is basically almost the same as treating long COVID.